Hi everybody, I'm Dr. Bannon. I'm one of the obstetrician gynecologists at the Women's Clinic. So today I'm going to do my first Facebook Live, so please bear with me as it's my first time. And just a few things to start off with, just some housekeeping tips. One is that if you're one of my patients and you say hi or something like that and I don't respond, just understand that it's because I'm in my zone and I'm trying to make sure I get through the topic in an efficient fashion and get all that information out there. So I apologize in advance if I don't say hi. It's not because I'm trying to ignore you, okay? The second thing is that I want you to understand that this is just general health information. It's not intended to treat anything specific to you as the viewer. Also, it doesn't create a doctor-patient relationship. So if you're not my patient already, it doesn't create that relationship, okay? But if you do want to become my patient or see a provider at the Women's Clinic, feel free to call us. I'm going to sound like a used car salesman. Call us at 723-8151. But if you do have questions and don't have a doctor or want to see one of us, that would be great. Just go ahead and give us a call, all right? The topic that I'm going to talk about, a friend of mine sent me an article about from the Washington Post, talking about how they did a study on primary care physicians that looked at male sexual dysfunction and female sexual dysfunction. And so I know for some of my OB patients and some of my other patients, they're going to be kind of disappointed that I'm talking about something about menopause today. But I do think it's important because what that study showed was that primary care physicians are very comfortable talking with their male patients about sexual dysfunction and Viagra and erectile dysfunction, things like that. However, they're not necessarily that comfortable talking to women about female sexual dysfunction. Now, understand, female sexual dysfunction is a huge topic, and there's no way that I can fully cover that in a Facebook Live. However, there's a small portion of that I do want to discuss, and it's something called atrophic vaginitis. Big medical term, basically means that the changes that are associated with menopause that happen to your vagina. Those can be everything from decreased lubrication to painful intercourse to difficulty with penetration with your partner or just general irritation all the time. Now, menopause doesn't necessarily happen to women that are in their 50s and 60s that go through natural menopause. It can happen because you've had surgical menopause from the fact that your ovaries were removed, or you can have it from the fact that you had radiation or chemotherapy. So you may be a 35-year-old woman who had their ovaries out 10 years ago because you had really bad endometriosis, and so you have these changes in your vagina. So because our primary care physicians are not, or it's just physicians in general really aren't talking about this, that's why I wanted to talk about it on my first Facebook Live. So I apologize if this doesn't necessarily apply to you, but I think that it's important that it'll apply to a lot of women that are afraid to ask that question, hey, doc, what do I do about painful intercourse after menopause? So there are like three categories of things that you can do in regard to atrophic vaginitis or these changes. The first thing is you can use a daily moisturizer like Replens, and it's really not a daily moisturizer, it's more like a weekly moisturizer that you can use up to 2-3 times per week. It's not necessary to use it before intercourse. You can if you choose to, but it's just something that you use on a regular basis. The other option is you can use lubricants, so stuff like KY jelly or Astroglide or Slippery When Wet. If you're using a lubricant during intercourse, I typically recommend a lubricant that is water-based and not that's oil-based. A while back when I started my career, oil-based, there was the concern that an oil-based would cause a yeast infection or a discharge. We're finding this not to be quite the case, but oil-based are typically more difficult to clean up after intercourse than it is to clean up something that's more water-based. So you're asking, hey doc, what water-based lubricant do I use? How do I know that's water-based? Well, probably the most widely available is something called Astroglide. It's in a clear bottle that's curvy, it's got a purple top on it. And you can find it pretty much at Walmart, Target, what have you. If you're embarrassed to get it at the store, buy it on Amazon, send it to your mother-in-law's house or whatever, and then they don't know any different. But it is available, it's easier to clean up. KY, I have a lot of patients that complain about it because it goops up or dries up and doesn't really do what you need it to do. So that's the first category, is just the lubricants that you can use. Now you're saying, well, doc, if it's because I don't have hormone where I need it to be, can't I just put hormone back there? That's the next category. So there's hormones that you can use vaginally that can help with these symptoms. So there's something called an estring, E-S-T-R-I-N-G. It's a ring. It's not very big. You put it up in your vagina, and you leave it there for 90 days, and it works over time. You also can use Premarin cream, estrase cream. Those are things that you use more on a daily basis or an every other day basis. You can also use a tablet that you place in your vagina. Those are all options. But just understand, because these are hormonal, you need to know that if you have a history of breast cancer or currently are being treated for breast cancer, these are not options for you. There are some newer things that are out. One's a tablet called Osphena. It's a tablet that's called a SERM, a big old acronym for Selective Estrogen Receptor Modulator. Basically, all that means is it's not an estrogen, but thank you for that heart. It's not an estrogen, but it acts like an estrogen. But the cool thing about it, it acts exactly where we want it to be, and that is in the vagina. And that's where you want it to work. So it does not increase your risk for uterine cancer. However, supposedly or theoretically, it's not supposed to increase your risk for breast cancer, but they still recommend that if you have a history of breast cancer or currently have breast cancer or are undergoing treatment for breast cancer, that you don't use this product. And that may actually change. The other option is a newer option that's been out about a year. It's called DHEA. What it is, it's a hormone that your body converts to estrogen, and you can use it vaginally. But also, even though it's DHEA, because it gets converted to estrogen, you can't use it. Once again, I sound like a broken record. You can't use it if you have a history of breast cancer or currently have breast cancer. All right, so those are kind of your options of things that you can use vaginally. They are lower dose so that you have a whole lot fewer side effects associated with it as opposed to using something oral. Now understand, just to be clear, the Osphena is an oral tablet that you use and not a tablet that you put in your vagina. Finally, the last category is some newer things that are really exciting, that I think are really exciting, and those are the use of thermal energy, whether it's via a laser or radio frequency, that you can use. The laser that's available, you have 3 treatments that are about 3 to 5 minutes in length. You have it once a month for 3 months, and it works really well. But understand that the laser only targets the inside of the vagina. It doesn't target the outside. Then there's another type called radio frequency energy. The brand name is Thermiva. We do offer it at the women's clinic. And what it is, it's a customizable form of energy. It basically is a wand with an electrode on the end that we use, that we paint the vagina with radio frequency energy. Understand that I didn't say radiation, it's radio frequency, big difference. And so what it does is it paints the inside of your vagina, and what that does is it helps bring collagen and moisture and change the architecture of your vagina so that it's closer to the vagina that you had before you went through menopause. Now understand that this product or any of these other products I've discussed aren't miracle workers. They're not going to bring you back the 18-year-old vagina. Your husband's not going to walk in and be like, wow, and you're not going to sit there and be like, wow, I see this huge change. But you will notice some significant change that makes intercourse more comfortable, that makes you more comfortable throughout the day. Thermiva is also 3 treatments over 3 months. It's once a month, and you can use it in the vagina for your atrophic vaginitis. The one really cool thing, like I said, is it's customizable. So a lot of women will have irritation at their clitoris, or they'll also have irritation at that no man's land that we call it the perineal body. It's that area between the bottom of the vagina and the rectum. And so what you can do is you can actually use this Thermiva to focus in on this one area so that you can have improved function there and not have that tearing sensation or that dryness sensation or that rough sensation during intercourse. The really bad drawback to both the laser as well as the Thermiva is they're considered cosmetic. And even though they treat a true illness or disease process or changes and a true medical condition, they are not considered, it's considered cosmetic and isn't covered by insurance. And so I know a lot of people get very frustrated that it's not covered by insurance. There's nothing we can do at the women's clinic or anybody else who offers it can do to help it get paid by insurance. We do know that some health savings accounts, HSAs, can be used for this. If you have any questions about Thermiva, you can call us. Once again, used car salesman, 723-8151. You can call us and set up an appointment. You don't have to be a patient of the women's clinic to use this. And you don't have to change doctors. If you see somebody else in town and you've seen them for 30 years and they've delivered all your babies, that's great. Just come see us for one visit. We'll go ahead and get you set up, do an initial consultation with you, 5, 10, 15 minutes. Make sure that you don't have any problems that would prevent you from using Thermiva, and then we would do the procedure. If you're already a patient, just give us a call. Understand that most of these we schedule in the morning because they're 30 minutes to 45 minutes in length, or we schedule them in the afternoon. But we can definitely schedule them around your schedule. But just give us a call if you want to do Thermiva, or if there's any of the other options that you want to do. So the Premarin cream, those things that require prescription, please don't hesitate to call us. And understand, the reason that I did this video is you may not necessarily be asked by your physician or even your gynecologist if you're having trouble. It's not something that we'd necessarily bring up. And a lot of people think, well, if my doctor didn't bring it up, then it must not be important. Just understand that it may not come up. We may be thinking about, hey, I need to get you a flu shot. Hey, I need to get you a mammogram. I need to get you set up with a colonoscopy. You need a shingles vaccine. So there may be other stuff that comes up in the visit. So just because we don't mention it doesn't mean that it's not important and that it's not important to you. So just remember to ask your doctor about it, and if they don't feel comfortable dealing with it, then come see a gynecologist. All right? So if you guys, I know it's a very sensitive subject, but I'll stay on here for another 15 to 30 seconds to answer any questions you might have. You can also submit questions to our website and ask some questions, and I'll try to get back to you. You can also post them in the comments, and then I can try to answer those questions. Remember, I can only answer basic general health questions and not necessarily give you a course of treatment. But if you do need something, the Women's Clinic is available for you. So are your other gynecologists in town. So are your other primary care physicians. We just want to make sure that you understand that this is a treatable condition. It's not something that you're sentenced to for life, that we truly can fix it. And it happens to women of all ages, depending on when they went through menopause. All right, y'all. And to Leah, we miss you too in the office. Good to see you. Thanks for tuning in. Thank you for all the likes and the hearts and all of that. I hope y'all had a very Merry Christmas and you'll have a fun New Year's. But you guys, if you need anything else, let me know. As one final note, I do want to do another one of these. I don't know if it'll be next week, but sometime in the near future, I'm going to talk about STDs. Woo, yuck. But there was a report by the Centers for Disease Control stating that that it's estimated 165 million Americans out of over 330 million Americans have an STD. So if you want to tune in for that, I'm sure I won't have hardly any questions about that, but we're going to try to get it so that you can ask anonymous questions. But STDs are pretty prevalent. Syphilis is on the rise. So anyway, this has already been a very long video. Thank you all for tuning in. I really do appreciate it, and I hope you all have a wonderful New Year's Eve and a good Tuesday. Talk to y'all later. Bye.